Should this test be used only for those who have already been diagnosed with cancer?
Actually, no. And the clinical perspective of that, working daily with cancer patients and family members and patients who have a high risk of cancer and families, we have found it to be one of the better tests to find cancer stem cells or tumor cells in the bloodstream way before probably even being able to be detected by CT scan, MRIs, PETs, or anything like that, because there's a certain mass that has to accumulate for these others measuring devices or tests to find the tumor, sometimes as big as 4 millimeters, sometimes as big as 1 centimeter, 1 cubic centimeter. It takes that big of one to find it, and normally there's not very many symptoms at that point. So we do know, based on the studies that have been done, that the tumor any bigger than 2 millimeters, and that's 2 millimeters, not centimeters, is most likely already in the bloodstream, because it has to do that to get rid of its waste and to get food or nourishment so it can grow. So tiny, tiny tumors, 1 to 2 millimeters, most likely in what would be considered, would not even be, there would be no symptoms whatsoever, are already working to cause the patient to have tumors any number of places. So by finding them early, then we can start work early, way before anything happens. And that by far, when somebody says to discover them early is the best rule, that is true, but this finds them much earlier than even most of the scans. I mean, there's very little possibility of scans finding that small of a tumor, because you have to look all over the whole body. And once it's in the bloodstream, it is all over the body. All you have to do is know how and have a company who can do that type of testing.
Very interesting. Dr. Yannis?
Well, what you heard before is really accurate. Of course, many issues have been raised from clinicians, which says, okay, what happens when we have healthy individuals and we have discovered these circulating tumor cells without identifying a primary tumor? How ethical, according to their point of view, is to start treating heavily such a patient? This is something that everyone realized that it is rationale. That's why for healthy individuals such kind of tests are recommended only when they have very strong family history, when they are exposed to factors that they can initiate or they can increase the risk of malignancy, or they start have very early symptoms of malignancy, like weight loss or night sweats, which they call asymptomatic, etc. So such kind of patients can become, such kind of healthy appeared patients can become candidates for utilizing such tests, and there are not so few actually.
I would also like to say one more thing, that the patients clinically that we have seen, we've found young women, we've had companies send in their whole staff of employees to be tested or screened, and out of say 6 or 7 that were in their 60s and 70s and 40s and 30s, it was interesting, the only one that was found in one group was the youngest one. And what was further interesting is that by changing lifestyle that early in the game, you can oftentimes eliminate the potential problem in the future. So waiting for overt symptoms of, sometimes is definitely not the best way, but by changing lifestyle, we will actually see those cells disappear or go into dormancy. Whatever they do, they're not in the bloodstream causing problem. And that's been clinically very interesting to me, and that's why I think the approach of finding it early, changing lifestyle, that may be all that needs to be done without pursuing chemotherapy and everything. So that's why I love the test, and that's why it has helped many people, and in some number of cases has kept them from having to go through these extreme chemotherapy treatments or even natural treatments with IV vitamin C and B17, amygdalin, all these other things. So I'm very much a proponent of let's find it early, make some lifestyle changes, recheck it, and guess what? They've succeeded at that early stage.